Imagine being told at 57 years old, 57, that you have Alzheimer's disease. It happened to Brent Beasley, and as a doctor himself, his whole world was upended. On today's All Things Brain Health, Brent shares the treatment that he's getting here at the University of Kansas Health System that has drastically improved his symptoms. Good morning, I'm Alexis Del Cid. Welcome to All Things Brain Health. That Alzheimer's diagnosis at 57 ended his more than 30-year medical career. We are so grateful, though, to have Brent Beasley and his lovely wife, Cindy, joining us this morning. Thank you both for being here.
Thank you.
And we're also joined by two of our neurologists here at the health system, Dr. Ryan Townley and Dr. Jeffrey Burns. Dr. Burns is co-director of the University of Kansas Health System's Alzheimer's Disease Research Center, and he is the one who diagnosed Brent when Brent was just 57 with Alzheimer's disease. How many years has it been, Brent, since your diagnosis?
Well, it was in terms of the diagnosis, I started having a lot of difficulties. I looked up last night in my medical chart, and because I had to remind myself, it was in July of 22 that I had a mild case of COVID that I think kicked this whole thing off.
And that is when you started sensing that something was going on? You had symptoms?
Absolutely.
So about 3 years ago. Was there a particularly bad day or bad string of events when you realized something is wrong?
Yeah, the next thing that happened was that life became really hazy for me. I felt like I was really in a fog. I had trouble keeping track in conversations. And even playing a new board game with my children that we were at the holidays became difficult. Every time it come around to my turn, I'd have to ask them, now what was I supposed to do again?
Oh.
And so that was troubling to my children, and
Sure.
They started asking, Mom, what's wrong with Dad?
So that's what sparked it. So you have three children, three grown children.
We do.
And a grandchild, Frank, that we were just speaking about. Cindy, what do you remember noticing? Because often it's the partner or the spouse or other family members that notice first.
Yeah, there were subtle signs at first. Every once in a while he would repeat questions, but you kind of, oh, well, you know, maybe he's just getting older. But then he's normally very OCD about where he puts things. All of a sudden his closet was disorganized, things on his nightstand weren't in the right place. He would go to put something away in the kitchen and he couldn't remember where it was supposed to go. He was having trouble keeping track of schedules. But the big sign to me was we were headed to the Nelson one night for an exhibit, and we were having this conversation about the sculptor that was going to be there. And we walk into the door and we sit down. They had appetizers that night, and he looks at me and he says, "So what are we seeing tonight?"
Oh, wow.
Completely had forgotten the conversation we had just had 5 minutes before.
Right. And how long have you been married?
We've been married 35 years.
So you know him. Well, I mean, you
Right.
know each other inside out.
Right.
Brent, you were a doctor before this in Oklahoma. Did it start to affect your job, your medical career? How did that start to affect things?
Well, in Oklahoma, I was fine. It wasn't until we had moved back to Kansas City that I actually, as I was saying, had contracted this really mild case of COVID that seemed to have started it all off. At that time, I was working in a clinic in Independence, Missouri, and my supervising manager was the one that asked me to come in and see her in the office. And an HR guy was there.
Oh, boy.
Yeah.
That's so hard.
And she told me that people were noticing that I was repeating myself. She fired me that day.
Oh, man.
I had a friend who was a neurologist, So I went and asked him what he recommended I do. And he said, if I were you, I'd go see Jeff Burns at KU.
And you did the right thing. You went to the best. Dr. Burns, is it common? I know I actually called you after I had COVID because I had brain fog, and I was already worried because my dad has Alzheimer's, had Alzheimer's. Is it common that people will come to you in those situations where they're feeling the brain fog and things?
Oh, sure, yeah. And that, things like COVID can kind of sort of reveal some underlying changes where, COVID makes you foggy, but if you have a little bit of new change, something like early Alzheimer's, it can really bring out those symptoms and make it more obvious to you and your family. And I suspect that's what happened. Sort of COVID brought out some of those symptoms and made them more observable. So,
can you walk us through the tests and the scans that you do and that you did to ultimately diagnose Brent with Alzheimer's disease?
Yeah, sure. Well, so the story is the most important thing. These changes for Dr. Beasley, 57 years old, and having these kinds of changes is something we definitely have to pay attention to. And so we do a lot to sort of listen to and understand what's been changing. And then we'll do some memory testing in the office, usually to kind of confirm that we're measuring some change. We'll get an MRI scan to rule out things like stroke or tumor, and then we will. In the case of Brent, it was early in the days of these new drugs, and we wanted to be aggressive, and so we did a lumbar puncture at that time. We can now do an amyloid PET or a lumbar puncture.
Lumbar puncture is a spinal tap. For people who aren't familiar with that, which no one wants a spinal tap usually, right?
No, usually not. They're a little scary, but they're usually pretty simple and pretty straightforward and pretty well tolerated. But yeah, so we did that. Then the purpose of that was to confirm the presence of something called amyloid in the brain. And so for Brent, we did see amyloid, and so everything lined up that this was looking like early changes of Alzheimer's disease.
So it was the amyloid that you detected in the spinal tap. Dr. Townley, you're the medical director of the health system's memory care clinic. How are the signs and symptoms of Alzheimer's different than general dementia?
Yeah, I think what the most common question I get in the clinic is what's the difference between Alzheimer's disease and dementia, right? I think they're often used as synonymous terms, but it's the reality of dementia is sort of like that umbrella term, right? There's lots of different causes of dementia though. So when we think about Alzheimer's, it's the most common, about 2/3 of causes of dementia are Alzheimer's, but it's really kind of the exact changes that are happening in the brain of how we define Alzheimer's disease. We often think of short-term memory or difficulties with board games and things, just like you described really well. But it can present differently in different people. Some people can have language symptoms or visual symptoms, so we have to be mindful of kind of the different ways it presents and then help utilize tests like the spinal fluid and other tests to help kind of confirm that cause.
So all Alzheimer's is dementia, but not all dementia is Alzheimer's?
No, it's a great question. So the thing is, you could have Alzheimer's disease and not yet have dementia too, right?
I'd never
you
heard
can
it that
have
way.
Alzheimer's changes of amyloid and things in the brain at very early stages, what we would call mild cognitive impairment. So it's not yet affecting someone's day-to-day life, right?
Okay.
I mean, that is still can be Alzheimer's disease, right? And that's where we really need to capture it. We need to capture it at those earliest of stages, right? Just like was done in this case.
I was going to ask, is it considered very early to capture someone's Alzheimer's at 57?
That's early onset, early age of onset. So we talk about early age of onset, then we also talk about early symptoms. And what Dr. Townley's talking about is before the onset of symptoms. This is where the field is headed, and where we think we'll be in a few years, where we're able to detect these changes of the amyloid plaques and tangles that we see in Alzheimer's before the onset of symptoms. And so we can do that on the research side, and we're studying, can we intervene, can we use these drugs at that stage to prevent dementia,
so in
Alzheimer's.
We're going to get into the study that Dr. Burns is doing, but it leads to the question, is your hope one day that this kind of test could be done during a routine physical?
Oh, yes. Yep.
That would be
is.
amazing. You would catch it so much earlier.
Yes, that's where we want to be.
As for the treatments that, Brent, you're getting, you started getting infusions in 2023. What are you infusing into Brent?
So what are we
is
giving
it?
him?
Yeah.
Well, we're giving him a drug called Leqembi, which is it's an infusion. It's not a pill, meaning we have to give it through the vein. But what it does is it pulls amyloid out of the brain. So it sort of uses the immune system. They're antibodies. What the infusion is antibodies targeting amyloid. So they go into the blood and the brain, and they stick to amyloid, and then the immune system pulls the amyloid out of the brain.
Where does it go?
Just gets
Flushed out?
Flushed out.
Like
yep.
through your kidneys? Or
Yeah.
That's incredible. So after how many infusions when did you start noticing an improvement, Brent?
After about 7 to 8 months, I was getting those infusions every 2 weeks. I was at church where I serve as a deacon, and I have a very scripted part of what I have to do and role in my church. And it had been difficult for me when I was first diagnosed. But there was this one day where I realized I'm back.
Wow.
I'm here. I'm present. I'm I know what's going on. I know where I am. I know what's going on. It was a real different change. And I would, after church was over, I went over to my wife and I said, I'm back.
Wow. Did you just burst into tears?
I could tell during that service. I thought, oh my gosh, he's back. And so when he came out, it was
wow.
just this confirmation of, yeah.
What did that look like? I mean, I would have burst into
I don't
tears,
even know how to
strapped to the ground.
describe it,
Yeah.
except that the clarity, that there was no stumbling. He was where he was supposed to be. He was reading clearly. I don't know when it's like somebody being in a fog and then not anymore. Right?
Like
and
the fog was lifted.
Yeah.
Is that a typical result, Dr. Burns? After 8 months?
I can't say.
Have you seen this dramatic of an improvement before?
Well, so we have, yes,
Yeah.
we tend to see stability from these drugs, where when people are responding, they tend to be stable. So this is an amazing outcome. I love to hear it. I don't know if we can expect that for every patient who goes on this, on one of these drugs, but it's what we want. And but what we're seeing is that some patients, out of the 250 that we've treated, many are staying nice and stable, and some are not responding at all.
Everybody's different. Every brain is different.
Yeah.
So then Brent goes in and you requested a second spinal tap. So how often does that happen? A patient comes in and says, I want another. Give me another spinal tap. But he wanted an update?
Yeah, and I guess that hasn't happened again. But no, we do actually now have a protocol where we want to measure amyloid again after we treat somebody for the full 18 months of the initial treatment. And in Brent's case, it was do another lumbar puncture, since that's what we did at the start.
We have the results that we can put up while we talk about these. So this is what you saw after the spinal tap. What are we looking at?
Well, so you see that line coming down.
Yeah.
And that line coming down means that his amyloid level went from high to basically the normal range, or what we see in somebody without elevated amyloid. So it went from elevated to not elevated, meaning the drug's doing its job of removing amyloid from the brain, which is great to see. Now, the key, though, is are people getting better from these drugs? We can move amyloid now, we know that, but we want to see people improve or stabilize. And the wonderful thing here was with Brent, we saw stability in his testing. In fact, I think maybe some of your scores went up a little bit. Again, we can't set that expectation that this is what we're going to see in everyone, because some people do very well and some people don't respond at all. But
as is in any medical situation.
Exactly.
That is so cool. Dr. Townley, you don't treat Brent, but you're the medical director of the memory care clinic. How could these results be applied to the people in your clinic now?
Yeah, so we get messages all the time. You know, a new news article comes out or a story like this. Hey, am I a candidate for these drugs? So that's something we always have to be thinking about. We have to kind of find people at the right stages of the disease, though. So it's important to realize that not everyone is a candidate for these drugs, right? So if they're kind of at a later stage of the disease, we haven't seen any proof that pulling amyloid out helps them or stabilizes at a certain disease stage. So yeah, it kind of takes a careful look at each patient to see, are you a good candidate where we might expect some benefit.
It's so incredible because when my dad was diagnosed or started showing signs, it took him a while to get diagnosed, but by 2019, he was so far progressed that he didn't qualify for any of these treatments or studies. And now we're seeing, these things weren't even happening when he was diagnosed, when we were living in another state. So it's really, would you say it's moving at warp speed, or is that
feels like it
an exaggeration? Yeah. Warp speed, the progression towards finding a cure, maybe?
Yes, I mean, we're really moving quick.
So hopeful to hear. And when you talk about the sheer prevalence of Alzheimer's disease, it's mind-blowing. Right now, 1 out of every 9 people age 65 and older has Alzheimer's disease in the United States. The National Institutes of Health predicts that by the year 2060, the number will double if no cure is found. And honestly, that's just the number of people who have it. But every single person who has Alzheimer's has people who love them so much who are affected by the disease as well. I remember being told when one person in the family has it, the whole family has it. Were you told that at first when Brent was diagnosed?
Yes, and we certainly experienced that. My kids are in their 20s, and to have this as part of their family life now was certainly not what any of us expected.
No, and so the fact that 1 in 9 people, 65 and older, has it is stunning. To that point, Dr. Townley, with so many people being diagnosed with Alzheimer's disease, how do you manage a memory care clinic? Are you getting, how do you manage with the increase of people needing the help?
Yeah, no, it's sometimes overwhelming, right? But it's a good problem to have. It's one we need to solve. So part of our strategy is to make sure we get the right patients in that have objective changes going on, because a lot of people over age 65 are worried about their memory, but we need to see the folks that have early changes, right? So part of that is partnering with our primary care colleagues. So at KU, we've been trying to initiate working with both family medicine and internal medicine to try to help improve the screening rate. So those at-risk folks, 65 and older, can we detect those changes early and then get them into either the anti-amyloid treatment clinic or to a diagnostic clinic to help get that early diagnosis. So I kind of talk about it kind of like it's going to take a village, right? And so it's going to require everyone to increase the screening rates, but then now that we have blood biomarkers and things, to test the right people, right, and to get those early diagnoses, because like you said with your father, we're oftentimes diagnosing it too late in the disease before we can do these types of interventions.
Along those lines, what is the reason you hear most for the delay in getting tested?
Yeah, no, there's a lot of different reasons. Sometimes it's from the patient level perspective, right? It's fear of what that might mean, right? From an independence perspective, from a, like we kind of talked about a couple weeks ago, that dementia and just cognitive impairment in general has a stigma, right? And so there's a lot of, weight tied to a diagnosis that we need to start lifting, right? But I think too, it's a barrier of access, right? Or the right tools to use to improve early detection. So that's partly what we do in the memory clinic, and Jeff and I with education is, what are those right tools to be using? Can we help others kind of learn from our expertise to help expand that knowledge?
I'm so impressed and happy that you were able to get Brent diagnosed early. That is a rare story to hear in the Alzheimer's world. I don't think I've ever heard someone get diagnosed that quickly in all the support groups. Did it help that you're a doctor?
I do think it did.
Yeah.
I knew who to go to.
Yeah.
I also, I wanted help. And I think a lot of times, especially if someone's living alone, they may not even realize what's going on with them. And I had a wife that was, really worried about me and wanted to make sure I got help.
Thank God. You did. The stage at which a person is diagnosed, does it affect eligibility for this particular treatment that Brent's getting?
Yeah, it does. And Dr. Townley touched on this a little bit. We want to start these drugs early. So the earlier the better. And at some point they become, basically all risk, no benefit if we wait too long. And Dr. Townley mentioned that if we're starting it in the sort of moderate stages, or we're starting it too late, then it's risk, cost, burden without benefit. And so that's where there are patients who come in and really want this drug, but they're testing a little too far down the road, too many sort of deficits, and we have to tell them the drug's just not worth it.
Right.
Yeah.
We already have some questions and comments coming in. If you have a question that you'd like us to ask the doctors, Brent or Cindy, or a comment that you'd like us to read out loud on this program, you can send that all to us right now on YouTube or Facebook. The links are right there on your screen. We love connecting with our viewers in real time. Cindy, we know that diet and exercise and sleep really can help with cognition. What kinds of strategies have you been able to implement into your family for you both since this diagnosis?
Well, it's interesting because we both have been on a plant-based diet for at least 7 years. So in terms of what we were doing from a diet perspective, we were already on target.
Right.
Brent is someone who doesn't necessarily enjoy exercise. I enjoy exercise, so pushing him and reinforcing that this is really an important part of your brain health, to make sure that that's consistent, I think is something that we've integrated more into our lives. So.
Are you starting to like exercise at all?
Oh, no.
That's all right. It's bonding time.
Exactly.
It's couples time. What kinds of things do you enjoy doing now that maybe you couldn't do back in 2022 when the symptoms were at their worst?
I really enjoy opportunities to speak, particularly about Alzheimer's disease and my own path to renewed health.
We had some video of you speaking at the top of the program. How often are you speaking about this?
Oh, occasionally, maybe once a month or two. So
it's powerful. So that's what you enjoy doing a lot?
I do. I also enjoy taking care of my grandson, Frank, and I get to spend 2 days a week with him, and we're at the zoo yesterday.
Oh, fun.
And so that's a real joy for me to be able to be present with him.
You're present and you're back.
Yeah.
KU, or the KU Alzheimer's Disease Research Center, is one of only 7 institutions in the whole world taking part in this particular blood test. This test is used to detect elevated levels of proteins that characterize Alzheimer's disease. Dr. Burns, is that the spinal tap we were talking about, or is this a different test?
This is a blood test, not a spinal tap. Yeah,
Okay.
something to replace spinal taps.
Okay, which would be nice.
Yeah.
So you're one of 7 institutions.
Yeah, we're part of this, something called the Davos Alzheimer's Collaborative Accurate Diagnosis Program. And yeah, we were given sort of support and resources from the Davos Alzheimer's Collaborative to bring on these blood tests and bring them into our health system early. Before they were FDA approved. Now they've been FDA approved just recently. We're starting to roll them out sort of as FDA approved tests.
That's incredible.
But over 6 months, we deployed these tests across the whole health system so that any doctor who wanted them could order it. We also did a lot of education and lots of other things that we're doing. But we've had about 1,500 blood tests ordered over the last 6 months, which is a lot.
That's incredible.
Yeah, so we're figuring out how do we use these optimally. Dr. Townley mentioned this. How do we use these optimally in primary care? How do we use them optimally in neurology and memory care so that we can make an earlier diagnosis?
So the study is complete. Now you're implementing the blood tests.
Exactly.
Dr. Townley, when it comes to the blood tests, what are the potential barriers to implementing this in, say, a yearly physical?
Yeah, that was a great question. It's the right question to ask. I mean, there is a world, maybe in the next 5 years or so, where that'll be a reality of that's part of your screening exam, just like we check thyroid and other lab tests where this blood test will be part of that. We don't recommend it right now because we don't yet know exactly what to do with a abnormal result if someone doesn't yet have symptoms. So the predictive value right now is about like flipping a coin. So, of whether someone's going to get symptoms over the next 5 years. We know this test changes before someone gets symptoms. So So it is going to be a valuable tool once we're ready for it, but we're just not quite at a point where we know, we don't have a treatment yet at that pre-symptomatic stage.
So it would just be bad news for someone without any plan.
It could raise anxiety levels.
I think it would raise it a lot.
Absolutely.
If you,
you could also argue, right, maybe it would empower someone to get their exercise and lifestyle things in place, but that would have to be a big program and counseling involved with, like, how do we enact on this, right?
a lot of moving parts, but man, that would be amazing if there was a point when it was just part of your physical, like checking your reflexes, testing to see if you have that. We have some questions coming in right now. I would love to get to Vera's. Vera wants to know, Brent, how did driving fit into your initial diagnosis to your status now? Are you driving again?
I am, and I really haven't had much trouble with the driving, and I don't know if that's just one of those activities that you've been doing since you're 16, and maybe you're a little more adept at that.
Reflexive,
Yeah.
maybe?
It was early too. Your diagnosis was early. So.
Do you think the diagnosis being early, Cindy, helped that? That's true, and it's great you still have your independence. Jeremy Yenser has a question. This is a good question. Does amyloid build up in an area of chunks like plaque or cholesterol in arteries, or is it more like a general salt and peppering throughout the brain? Who wants to take that one?
I guess I'll take.
Okay, that's a good question. I wonder what it looks like.
Amyloid tends to build up like salt, I guess the salt and pepper idea, where it's kind of everywhere. When it starts to accumulate, we tend to see it everywhere. There are some areas that we see more of it, and we see it start in a sequence in certain areas. Something like tau, the tangles, do tend to, really hit certain areas more than, say, amyloid. But yeah, amyloid, when we see it, it tends to be kind of everywhere.
So we have the amyloid plaques, which is what the blood test and the spinal tap are testing. Can you explain in non-medical terms then what are tau tangles that you just mentioned?
Yeah, the tangles are something we see. These are things we see under the microscope. The amyloid plaques and the tangles are things we see under the microscope in the brain in people who have Alzheimer's. And amyloid plaques are sort of this plaque that builds up on the outside of cells. Tangles are, if we look in the cells, we can see these tangles building up in the neurons. And they clump up, and they actually, a dead or dying neuron is a tangle.
Oh.
Yeah.
Okay. And you can't get that out if it's blocked by the amyloid plaques?
Well, somehow the amyloid plaques are maybe, adding fuel to the fire of the buildup of the tangles.
Shoot. Okay.
Amyloid plaques appear to come early in the tangles and influence the rate of tangle development.
Marcia has a question about testing. Dr. Townley, I'll ask you this. Marcia wants to know, how does one go about talking to their primary care doctor about getting tested? Is there another entry point?
Yeah, that's a great question. I think that's part of, as a society, right, as a medical community, we have to take brain health seriously. We say in stroke that time is brain, but that's also true for Alzheimer's disease and what we deal with of diseases that change over time. So if someone comes with concerns, right, taking those seriously, right? I think that's where getting a cognitive screening test and using a good cognitive screening test, any primary care clinic is at least capable of doing that. Or if they don't have that availability, referring to a neuropsychologist to get detailed testing. I think those are two pathways that, how can I get a good baseline of my cognition?
Alex has an interesting question. Alex wants to know, could someone else benefit from these infusions even if they don't have Alzheimer's? Are there other treatments for persistent brain fog? That's a great question because there are a lot of people in menopause who have brain fog, or people who are recovering from COVID that have brain fog. Could they get this this infusion?
Well, no. This infusion only helps if somebody has memory changes that are associated with the buildup of amyloid.
Okay.
So yeah, no, not something for sort of general brain fog, but more specifically to remove that amyloid from the brain and try to deflect this decline that we're seing.
You would have made a lot of women happy.
Yeah, no.
If you said that, but
Good sleep, exercise.
In increments, right.
Maybe coffee.
Right. I'm doing everything. Yeah. Patty has a question for the doctors. Is this the closest thing you've seen to a cure? I know we use the C word, but...
Yeah, it is not a cure.
Right.
But yeah, for sure. This is like, this is a big victory to have someone like Dr. Beasley sort of telling his story and you know, showing these kind of benefits that we've seen. You know,
Yes.
it isn't a cure, you know, and we're working really hard, and we got a lot of work to do, but I think we're going to get there, where we are going after the changes in the brain from a lot of different angles. This is the first angle where we're really attacking it, and you can see where, you know, it's a victory, but it's not a cure.
It's really people like Brent and Cindy are people we need more of you in this world, because you're raising awareness, and you're coming on the show, you're talking publicly. Just want to thank you so much for being so vulnerable and for sharing your journey with everyone. All the speaking you do is helping. Every single person goes home and talks about that, and it raises awareness. Is there anything specific you want our viewers to know, to take away from this conversation, Brent?
I think if you're having any concern, first of all, talk to your doctor, and realize also that we're in an age of hope here that we haven't had before.
Mm-hmm. Amen to that. Cindy, what do you want our viewers to know as a family member of someone who has Alzheimer's?
Yes, that you are your best advocate, and that you will need to advocate. Mm-hmm. And you may even need to push at times, but also be aware that you have a team with you, and to be kind to that team as you push, but you need to advocate. And even if you doubt yourself, even if you get a no, push a little more.
Keep going.
Mm-hmm.
Is it worth bringing up just the insurance problems that we've had?
Have you had a lot of insurance
Yes.
problems?
With younger onset, it's going to be more common because Medicare covers the treatment. But if you're younger onset, we're still in private insurance, so that can be a challenge. So that's another area you have to advocate in.
So frustrating.
And when you lose your job, you
Right.
lose your insurance.
Right.
We didn't even touch on that yet. That's right. So how have you been, you've gone to private insurance because of that and getting trouble with that?
Every 6 months,
Yeah.
I call
There's
Dr.
a
Burns'
fight.
office and say, yes, well, they've canceled us again.
Oh my
So, yeah.
goodness.
So they come up with a new test we need to do or some way. Now, to be fair, we're putting an airplane together in the air, right? The insurance company is, everybody is, all of the systems
Right.
are.
Yeah.
So we're still just trying to figure out processes. So we are guinea pigs at this point that are.
But don't give up. As Brett was
Exactly.
saying, if insurance says no, keep pushing. There's usually a way through. Dr. Townley, what do you want our viewers to know?
Yeah, I think I'll go along the lines of hope here. We're seeing some data released now in the new trials that, you know, these drugs right now are kind of the first phase, the first wave of these drugs. So there are newer ones that are much safer, that are even, you know, we need to obviously see the benefits in a larger trial, but we're doing those trials right now. And so if we can get safer drugs that target amyloid faster, that's going to be a benefit. And then we have a clinical trial going on right now where we're targeting folks at these early stages. So I'm the principal investigator at KU for that. We're one of the top enrolling sites across the world of this trial. So we're following 1,400 individuals, and if we can clear plaques even before they get symptoms, will that slow down the disease? That's what we're waiting to see.
That'd be incredible. How do people know when a study is coming up? There's a lot of people who are hearing that for the first time and think, oh, I would have loved to have been in that study. How do you find your participants?
Yeah. So we do have a website that we're doing a little bit better about keeping it updated. But joining our My Alliance program, we have an email list that goes out every Monday to people, and it has a list of enrolling trials, because these are changing all the time. Of, you know, there's a certain enrollment period, and then we get new trials added on. So we're about to have 2 new trials starting. But how do you know about those? It's signing up for those newsletters.
Okay, so sign up for the newsletter of My
Alliance.
My Alliance. Okay. And Dr. Burns, what do you want our viewers to take away from this conversation?
Well, I'll just reiterate, time of hope. It's a really exciting time. We are making strides forward. And I guess I would say also that our job, Dr. Townley and I, is to make it so that everybody who, you know, deserves this drug and needs this drug can get it. And they don't have to be a doctor with a wife who knows how to, you know, get through the system and push.
Yeah,
and really
that's good that you
amazing,
do.
you guys. But you know, we want this to be accessible to everyone, and we're working really hard to sort of redesign the clinic and work across the state and across the region to do that. But it's going to take time.
Time and support. Dr. Burns, Dr. Townley, thank you. Cindy and Brent, thank you so much for taking the time to come here this morning and join the show. We really appreciate you being here.
Glad to be here.
And thank you to our audience for joining the conversation. We'll see you right back here tomorrow morning.
What do you do when facing liver failure from a rare disease? I'm Jessica Lovell on the next Open Mics with Dr. Stites. Christina Schadegg needed help, and she found it from a stranger. The emotions and coordination that comes with a transplant and a new beginning. Wednesday at 8.